Welcome to JF Nursing class. Today in this video we'll discuss about the common sites for the assessment of pulse. So normally several kind of pulse we are assessing in the several part of the body. In this video we'll discuss in details about this assessment of the pulse in the different part of the body. So as you can see in this picture, there is first one is the temporal pulse. We can assess here in this that anterior lateral part of this forehead. We can check this temporal artery is present. In this temporal artery, we can temporal pulse can be assessed here. This is temporal pulse. Yeah. Then carotid artery is there. In carotid artery, carotid pulse we can assess. Then apical pulse we can assess in the apex of the heart, which is present on the fifth left intercostal space, mid clavicular line. Then brachial area, this brachial pulse we can assess. Then radial artery, in radial pulse we can assess. Then this femoral part, femoral artery we can assess the femoral pulse. Then popliteal pulse below the knee, the backside of the knee, popliteal artery is present. In this popliteal pulse we can assess. Then pedal pulse, dorsal pedis part of this foot we can assess the pedal pulse. Then posterior tibial pulse we can also assess. Okay, these are the different sites of pulse. So one by one we'll discuss in this video. So first on carotid pulse. So during CPR normally we are pulse site. This is the pulse site, carotid pulse. So this is the carotid pulse area. Normally this carotid pulse mainly used during CPR. During CPR time we are giving, that time we can't check other pulse area. You should directly check on the check for the carotid pulse during CPR. Then apical pulse assessment of the stethoscope. Normally for the when you are putting the stethoscope, that time we are only this apical pulse only we are assessing. Then brachial pulse for the assessment of blood pressure. When you are assessing blood pressure, that time brachial pulse are used. Then radial pulse to count the pulse we are using the radial pulse. Then femoral pulse for the assessment. Then popliteal for the assessment. Then dorsal pedis used to evaluate the arteriosclerotic disease. Arteriosclerotic disease. For any kind of arteriosclerotic disease is there, for that time we are using this dorsal pedis pulse. So that if a pulse is not available, means this artery related any disease is there, arteriosclerotic related disease is there, if not there. So through this assessing of this dorsal pedis, we are able to identify this any kind of arteriosclerotic disease is present or not. This is the area. This is dorsal pedis or pedal area. So here are some key points also there. We are going through this. So bobbing head with each pulse is seen in patient with aortic regurgitation. So bobbing head with each pulse is seen in the aortic regurgitation. Then water hammer pulse is a features of aortic regurgitation. So in aortic regurgitation, in case of aortic regurgitation, there will be bobbing head with each pulse is seen in a patient with aortic regurgitation, and water hammer pulse also is the features of aortic regurgitation. When a pulse rate is irregular, it is best to count the apical pulse for full minutes. When other pulse is irregular, that the most significantly we can count for the apical pulse. Apical pulse can be auscultated in the mid clavicular line in left hip intercostal space. We can count this apical pulse.